first topic is going to be what is diabetes and what is prediabetes, which we used to call metabolic syndrome, and we still kind of interchangeably call it that way. And what are the risk factors for diabetes? And how can you delay or prevent developing diabetes? All right, so first of all, a little bit of definitions. So what is prediabetes? Well, obviously it's what comes before diabetes type 2. It's when your blood glucose is higher than normal, but it's not quite high enough to be considered diabetes. And I'll go to the numbers with more specifics later. And you can have prediabetes right now and not even know it because it doesn't really give you much symptoms. All right. So a little bit on statistics. There's about 86 million Americans over the age of 20 that already have prediabetes. And 1 in 3 Americans will have diabetes and will develop diabetes. So 9 out of 10 with prediabetes totally unaware that they have it. And the key is that you're more likely to develop diabetes within 10 years of having prediabetes. So metabolic syndrome, that's how we used to call it. It used to be called syndrome X as well. It's a cluster of different risk factors that you can have that are associated mainly with obesity, and they're manifested by having insulin sensitivity or resistance. We call that having an impaired glucose tolerance, okay? And you will have some borderline numbers, like you will have a low HDL, which is the good cholesterol, what we call the good cholesterol, and you will have a high triglycerides. And a lot of times you would have also what we call hyperglycemia, which is an elevated fasting glucose, okay? So we use 3 criteria to diagnose metabolic syndrome. Blood pressure, higher than 140/85, or already having a diagnosis. A fasting blood sugar more than 110. HDLs in women less than 50, and for men less than 40. Triglycerides more than 150. And waist circumference more than 35 in women and more than 40 in guys. Guys always have a little bit of a benefit. You guys can be a little fatter, but hey, that's because you guys have testosterone, but that's another topic. All right, so that is your poster child for metabolic syndrome, okay? Sure, you know a couple people could look just like that. They have genetic factors, which is it's big in diabetes, environmental factors, and then you're going to have some abnormal vascular response, high blood sugars. You're going to have, cardiovascular events, the high triglyceride, high blood pressure, inflammation, like pain in the joints, swelling, increased incidence of gout, that type of things. Those are the little itty-bitty details you start seeing that go with metabolic syndrome. Yeah? Sort of immunocompromised, is that what you're saying?
And you're already very large, obesity, but you're not, you have been tested for diabetes, but not yet. I mean, it's my daughter, she needs more prone with it.
So for the people through telemed, the question is if you have an autoimmune problem, I would imagine something like fibromyalgia or lupus or any of that, or rheumatoid arthritis, are you at a higher risk of developing diabetes even if your numbers are normal? Are you more likely to have it? And the answer to that is yes. It is, because a lot of times it's an immune response. Not necessarily they will have it, but they have a higher risk than someone that does not have any autoimmune issues. So yeah, so the key is, keep checking, and prevention. Definitely someone who already has rheumatoid arthritis, it is essential that they maintain a healthy diet, an anti-inflammatory diet, and that they're exercising, because as you will all know, it's on the TV, body that stays in motion remains in motion, so. All right. So prediabetes, impaired fasting glucose, these are the kind of the typical numbers we tend to use, 100 to 125, and that will mean if you go get your blood work done and you were fasting, You know, like from midnight on, you didn't eat anything. You had a little water. You had maybe a little coffee, but nothing else in your coffee. No creamer, no sweetener, no nothing. And your sugar showed up as 100 to 125. That's what we consider an impaired fasting glucose. Okay? Or if you had that and the doctor decided to do a glucose tolerance test or a challenge, it can be either a one-time, you do a 1 hour with 75 grams of glucose, they'll make you drink that nasty stuff, or you do the 2 hour, okay? And if at that time your sugars are between 140 and 199, that's also a category. Or now we've been using the A1C. We didn't used to use that as a diagnosis, not totally fully agreed that that is for diagnosis, but we tend to use it a lot of times. If it's between 5.7 and 6.4, that means that your increased risk of diabetes goes up by 9. Okay? So in 50% of people with an A1C between those numbers develop diabetes within 5 years. Okay? So, you know, that's kind of the thing to look. All right. So 6 to 10% of people that have these criteria will develop diabetes per year. What can we do? Okay, so what is diabetes per se? All right, when your blood glucose are higher than normal, and what happens is not enough insulin to allow the glucose to enter the cells. Okay, so do remember that when you eat, you have your carbohydrates, you have, you ingest your food. That's going to be that's your sugar load, and the body is supposed to then tell your pancreas, hey, send all those send the insulin levels, because the glucose is a big molecule. Okay. So it cannot get transported by itself, all right? I always describe them, they're like a bunch of teenagers in a party. So they don't have a car yet, so they're kind of there loitering. So then you need your insulin that comes from your pancreas to come and gather that insulin. So the insulin to me is the cars. So those cars got to come over, grab the sugar, take it where it needs to go, okay? So what happens when you don't have diabetes? Well, you have a good coordination between the amount of carbs, the amount of insulin, and the amount of sugar, or teenagers, okay? And gets them, takes them home, all right? So when you have pre-diabetes, what happens is you don't have a good enough coordination there. So you have all this sugar load because you're ingesting it, okay? Because, that's why we're obese, because we eat a little bit too much. So you have all those, and then you have your insulin, and they're not getting together, all right? So I'll explain a little bit. In type 1 diabetes, it's a situation of not having carbs because the pancreas do not send any insulin, okay? So you have the carbohydrates and absolutely no carbs. That's why the treatment for that is strictly insulin, okay? But type 2 diabetes is a problem of receptors. So it's a situation of coordinating the insulin that the pancreas is secreting with the sugar, with the kids, okay? Carbs and kids, to get them together, to take them away. All right? So what happens? When you have pre-diabetes, you're starting to have issues with communication. So your pancreas is producing insulin, but it's not getting together with the sugar. Okay? All right. So those are the sort of 3 types. We have more, but just to keep it simple, type 1, as I said, is typically in children, young adults, people who have lost their pancreas, things like that. Because remember, it's not enough. The pancreas does not send insulin. All right. Type 2 diabetes, that's the most common, particularly in developed countries. Why is that? Because we eat, because we do not have a lack of food. See? So we have, our bodies are not used to not having food. We're never really in starvation. I mean, you might not eat because you decide to fast, but that doesn't mean your body's in starvation mode, really. Okay? All right. And then gestational diabetes is the only one that's a little bit different. That is for obviously people when they're pregnant, then they have more resistance with that insulin. The important thing is that it carries a higher risk for diabetes later on. All right. So the signs and symptoms, and as you see when you look at this signs and symptoms, you can have this for many reasons. Okay. So they are very iffy. Increased thirst. Increased hunger, unexplained tiredness, not because you've been partying, not because you have not been resting, not because you have insomnia, okay? More urination than usual, blurred vision. A lot of times that's the only symptoms you kind of have. And then you go to your eye doctor and they say, you should go check your sugars. They're not right. Sores that won't heal. That's a really important one, okay? Dry, itchy skin, I mean, it's winter. What can we say? But the truth is, most people don't have any symptoms. None at all, okay? All right. So when we're trying to identify patients, and the reason I put this slide here is like for you to say, how many of those do I have? Okay. No exercise, couch potatoes. First degree relative with diabetes. Parents, siblings. Grandparents are important, obviously. But if you have a parent or a maternal, paternal grandparent, those are the ones that count. Not if you have uncles or aunts and whatnot, not so much. High-risk ethnicity, African Americans, Latinos, Native Americans, those have a higher risk. Do Caucasians get this? Absolutely. Okay. If you've had a baby more than 9 pounds, or you had gestational diabetes, if you have any type of cardiovascular heart disease, if you have hypertension, if your HDL is low, your triglycerides are high. All those things. If you have PCOS, which is polycystic ovarian syndrome, also has a higher risk of diabetes. Acanthosis nigricans is, it's kind of a darker coloration, kind of velvety feel to the back of the neck and sometimes in the back of the elbows. And that is because of insulin accumulation in those areas because of the resistance. All right, so how do we diagnose it? All right, so remember, diabetes, fasting, sugar, and this is to definitely say you have diabetes, okay, not pre-diabetes. If you have a fasting blood sugar of 126 or higher, we repeat that test, and if you have 126 or higher in a subsequent test, that is a diagnosis. Or if you show up and you have a 200 or higher, that is a diagnosis of diabetes, okay? Only one time. Pre-diabetes, if you're between the 100 and 125, we worry. So this is what we use. Normal, less than 100. 100 to 126, pre-diabetic or metabolic syndrome, if you have the other risk factors. Or 126 times 2 times is diabetes. So what are the things we look? All right, well, when we are checking you, we're going to check something called BMI, and that we hate it. That's when you go to the doctor and they tell you, do you really have to get my weight? Well, yes, we do. Okay, you don't have to know it if you don't want to, but we need to know it. So we need to do your weight, and we have to measure you. We have to check your height, okay? That's really important. And if you go to your doctor and they don't check that, you're doing yourself a disservice. Get that done. And then we calculate that. There's a little, I had it in my slides. I figured it wasn't that important, but we calculate that, and based on that, that gives us kind of an estimation of if you're overweight, if you're obese, or if you're morbidly obese. And we take this, I mean, it is a tool that we use. It's not a tell-all, okay? If normal is 18 to 24, 25, overweight between 25 and 30, and above 30 is obese, above 40 is what we call morbid obesity. But just so you have an idea what that is. Okay, waist circumference. That's something that we're starting to pay more attention. So when you go to your doctor's office, they might tell you, hey, we're going to do your waist circumference. And that also is a good indicator for pre-diabetes or diabetes. Men, you guys have a little leeway, 40 inches. Us girls, 35. And this is important. This is how you measure. It's not down there, guys. See? If you do it there, that is not your waist. This is your waist. You got to get the belly fat. Okay? That is how you get it. All right. So get your blood sugar checked. That is really important. I have a lot of patients. I worked for 17 years in Colstrip. My dear old love Colstrip, which is a rural town. The patients always say, I don't want to get it checked because if I don't know, I don't have it. And the truth is, well, I mean, you can live in that fantasy world if you want to, but you have it if you have it. So you might as well find out and do something about it. Or not do something about it, but at least it's your decision. All right. So if you're 45 years old or older and overweight, you should check it. If you're 45 and not overweight, well, it depends on your family history. Because do remember, we have people that are not overweight who develop diabetes because there is a significant genetic component. Okay? If you're underage, but under 45, but overweight, and you have an increased risk, you definitely want those things checked. All right. So remember there, diagnosis, normal fasting below 100. These are your key numbers. 100 to 125 pre, and over 126 times 2 times diabetes. All right. So what do we do? And we'll talk a little bit more about this, but we do intensive lifestyle management, lowering weight, some medications, and metformin is kind of the gold standard that we use. The reason we use metformin so much is because, as I told you guys, you have your sugar and you have your insulin. Remember, the kids and the cars. Well, metformin is the one who directs the traffic and says, I need so many cars for so many kids to go somewhere else. So that's why metformin is used early on so frequently, okay? Metformin will direct and get all those guys together, okay? All right, you want to have your lipids and your blood pressure targets always under control, okay? And I always tell my patients, nowadays, the therapies we use multiple therapies. So patients are like, well, I'm in one blood pressure medication. I don't want to take anything else. Well, it doesn't work that way because you cannot just increase one type because then you have more side effects. So we need to sometimes do 2 and triple therapy, particularly for blood pressure and diabetes, in order for them to work together in different areas. You have less side effects and you do better, but you have to take multiple pills. Or you have to take a pill that is combined, okay? So that's important to know. All right. And monitoring. Even if you have not developed diabetes, you got to keep on checking, Checking your blood sugar every 5 years doesn't cut it. You have to do it every year, okay? That's what we try to do health fairs on a yearly basis. All right. This one's kind of the same. Remember, if you have a random of 200, what's a random? Let's say now I decide, well, let's check everybody here. And if we check everybody and you tell me, no, I'm not diabetic, and you have a 200, you're automatically a diabetic, okay? That's a random. Or the 2-hour glucose tolerance test. We don't tend to do those too much, but we do sometimes. And then you confirm it. All right. So where do you start? You're like, okay, now I know those numbers, so what do I do? All right. Well, if you go to the diabetes.org, they have an American Diabetes Association risk test that you can actually take online, okay? And it's going to have certain criteria, and then it's going to give you a score, all right? So if you have 3 to 9 points, then your risk of developing diabetes is kind of low. If you have 10 or more, then your risks are higher. So what do? Okay, then you start working all the things that we're going to work with you. All right, I just put this because I thought it was cute. I'm going to order a broiled skinless chicken breast, but I want you to bring me lasagna and garlic bread by mistake. Yep, that sums it all. All right, so do remember, you are in charge. You can prevent developing diabetes earlier. Okay, I don't want you to take this wrong. Some of us will develop diabetes no matter how great we are. Okay, it's not a failure from your part if you're doing everything that needs to be done. Okay, some of us just will develop it. But there are a lot of things you can do to delay the onset. Because remember, what are we treating? What we're actually treating is end organ damage. Why? Remember those teenagers that I told you were at the party, all that sugar? Well, if no cars come and pick them up, you're eventually going to kick them out of your house. So where are they going to go? They're just going to walk around. And where are they going to end up? Behind your eyes, in your heart, clogging your arteries, in your kidneys, in your toes. That's where those kids are going to end up. Okay? And what are they going to do once they're there? Loiter. And that's when you end up having amputations in your feet. You end up having vision problems. You end up having kidney failure. Okay? So that's why you need to work on reducing the carb load. Okay? And improving your insulin process. Okay? All right. So working on the high blood pressure, smoking. Don't even get me going with the smoking thing because that's going to take me an hour. But smoking is associated with everything from A to Z of problems. Okay? In every single conference you guys go on prevention of whatever, smoking cessation is going to be at the top of the line. Okay? So if you decide you do not want to quit eating your ice cream, okay. If you decide you do not want to exercise, okay. But you got to decide to quit smoking, because that is what's going to give you the best possible health. Okay? So if you're not smoking, then work with your family. Don't nag them. Just talk to them and work with them, because smoking cessation is the most important thing you can do for your health. Okay? Actually, it should be like the top. All right. So high fat and cholesterol levels, being overweight, sedentary lifestyle. All right. So the good news. Good news is that research has shown over and over and over that you can change in your lifestyle can delay or prevent you from developing diabetes type 2. Okay? All right. So briefly, I'm going to go on obesity, because that is kind of the, smoking, and then obesity goes right there. Okay? So there's around 300,000 preventable deaths per year, okay, in the United States due to obesity. Okay? Remember, only tobacco causes more death. Okay? 33% of women and 28% of men in the United States are obese. And why is that? Because guys have testosterone. Testosterone helps them lose weight. Have you ever made a diet with your husband, and you are great, and he's so, and he loses 15 pounds and you lose 5? That's testosterone. What can we do? All right. So why are we obese? All right, well, it's multifactorial, okay? It's not a problem only of this is important. It's not a simple problem of willpower or self-control. In the diabetes endocrinology department, I worked a lot with obesity, and I have patients who cannot be any better. I mean, they are doing everything that needs to be done, okay? They have willpower, they work hard, okay? But their genes sometimes are against them. So we work with different options, all right? So it is a very complex disorder of appetite regulation and energy metabolism and all the rest of their conditions. All right. So the key is that our American lifestyle pattern just is influenced to gain weight. Our portions are bigger. The type of foods are more processed. We're always rushed. We don't value eating, taking time, what we call mindful eating. Okay. So that is what we need to start changing. So weight management. If you're overweight, losing 5 to 10% of your body weight would be enough. So, I mean, we're not asking that if you're 200 pounds, go to 150. A weight loss of 50 pounds is significant. No, you have to lose 10 pounds, 15 pounds, okay? That will make an impact, okay? All right. So, briefly, the 5 A's of a weight loss. First, you got to ask yourself, am I ready? This is like smoking cessation, too. Am I ready? If you're not ready, you're not ready. And if you're not ready, it's not going to work, no matter what we try, okay? It has to come from within. So then advice. How can I improve my weight and exercise? Okay? Talk to your dietitian. Talk to us at the clinic. Talk to friends. Go to Weight Watchers. Any of those programs are there to support. Then this is key. Get your details. Your BMI, your weight circumference. Know your family history. If you're adopted and you don't know your family history, okay, what can we do? But if you have family, talk to them, for crying out loud. Get your information, okay? Get your history. Then get information and resources. What is out there for me to help me, okay? And then you get started in a weight management program. All right. So how many times should I push the elevator button to equal the same calories as taking the stairs? Does anybody know? All right. So I'm just going to go very quick on this because Therese's turn. She's going to talk about how to do all this good stuff. But how can I reach the goal? That's the key. You want to increase your physical activity. And I'm not telling you go and run a marathon. Okay? I'm just saying start with 10 minutes a day and then work out until you can do 30 minutes a day. They don't even have to be together. You can do 10 minutes, 3 times a day, 5 days a week. Okay, to a goal of 150 minutes a week. Okay, all right. Try just to choose more healthful diets. Okay, I mean, if you tend to eat in McDonald's, that's okay. Just don't always get the Big Mac. Try to get a salad. Instead of the fries, get the apples. Instead of the supersized Diet Coke or Coke, get water. Okay, little choices. Okay, all right. Use your nutrition label. That's important. Reduce unnecessary calories. Okay? Do remember that when you drink alcohol, and I'm not telling you have your little glass of wine. Hey, that's good. Has good tannins, makes you feel good. Hey, that's fantastic. But if you have alcohol, alcohol turns into 100% calories. It's all sugar. Doesn't matter if it's light. Doesn't matter if it's ultra light. Doesn't matter if it's super duper duper light. It is still sugar. Okay? So figure out, am I drinking my calories or am I having dessert? So you got to kind of figure that out. But don't have the cocktail or the 5 beers or 3 beers and the cheesecake. See? You can't do that. All right. Expand your nutrition and education in schools. That's something that they are working really hard on doing. See what your community offers. The Y here is fantastic. In Coastal, we have a phenomenal recreation center. So, all right. So hints for helping you stick with your exercise. Choose an exercise you enjoy. Walking, whatever. Talk to friends. Find an exercise buddy. That's important. Set goals you can reach. Don't try to walk 3 miles a day first day. It's not going to happen. Okay? Keep the cost low. You know, I tell my patients, get a balance ball. That's fantastic. It costs $18 in Walmart. You know, very easy. If you don't have to do it too much for your knees, but you can start exercising with that. Okay? Exercise just won't happen. You have to plan it. Okay? I have a couple of shows that I like to watch every week. You know, I just love my Thursday shows, the Blacklist and whatever. So I have my exercise ball, and when I'm watching my show, I exercise right in front of the TV. So I can watch my show and exercise at the same time. Okay? So you just have to kind of find ways. Okay? All right. If you weigh, let's say, 200 pounds, losing 10 to 20 pounds makes a huge impact. Okay? So we're not talking 50 pounds, 40 pounds. Okay? So that kind of gives you an idea. All right? So my doctor told me to start my exercise program very gradually. Today I drove past a store that sells sweatpants. So hey, that's something. All right. So weight management. Now it's Therese's turn, and she's going to kind of go through the different dietary, physical, behavioral therapies, everything you need to know. Thank you. All right. So there you go. Did we pass you to? Okay, you want to go right up that one? There you go.
All right, thank you, Dr. Ortiz.
You're welcome, sweetie.
And all right, nice to see you all. I'm Therese. I'm one of the registered dietitians in the diabetes department. And my objective is just to give you some more information on strategies you can do to help achieve weight management goals and hopefully make them achievable and sustainable for you too. So we're going to focus on dietary therapy, physical therapy, and behavioral therapy strategies. And I realize that this picture is just the visual of Dr. Ortiz's slide of the 5 A's, sort of presented a different way, is that you really can't do it on a whim. You need to have a plan, and you need to have a support team, whether it's your healthcare providers or your family or your friends, and you have to have a strategy. So we're going to focus on the farthest triangles on the left, but just to re-emphasize, know your numbers, and that's why you go get your annual exam at your provider's office, and you go to health fairs, and you go to presentations like this, so you can interpret what those numbers mean when you see them. All right, so has anyone been on a diet before? You know, I try to figure out, like, accurately how many diets are there existing right now, and they're just a lot of them the same plan by a different name, so I don't even know, but do the ones listed on here look familiar, popular? Any other fad ones in the mix right now? HCG, yep. Anyone else? So do diets work? No? Why don't they work? That's right. Something you start and something you stop. There's no behavior change component there. So you usually regain the weight. Absolutely. What are other reasons why people discontinue diets? Right? So they don't look at it as a lifestyle change. It's temporary.
Discouraging
Yep, it's discouraging after that initial weight loss. Expensive. Cost is a big one. Yeah. Thinking of one other kind of big factor. Any other? Yeah, restrictive. They don't let you eat the foods that you want.
After a while,
Mm-hmm.
you're still on the same food, and it gets boring.
Yeah, boredom is a big reason as well. So, I mean, there really is a Twinkie diet, and there really is, you know, some of these foods, if that's all you can eat and it sounds appealing, but it gets old after 2 days, of course it's not going to work. In addition to, it does not provide a lot of nutrition for you either. So, you need to have a strategy, and if we can adopt small changes and make new habits, that's where you're going to get long-term success. So, and you always see a new headline, you know, daily practically, and so that's why I liked this cartoon. I don't know if you can read it, but it's a young lady pouring cereal on the floor, and she says, "Free the gluten," and her friend says, "Does that make you a serial killer?" So I tried to come up with something. I wish I had the latest and greatest, but that doesn't exist, and so my approach is humor. So bear with me. All right. So the middle of that pyramid was tipping the balance, a hypocaloric diet. No matter what program or product or what have you, what they have in common is a calorie restriction. We need to eat less in order to successfully lose weight. So to show what that might look like, to lose 1 pound per week, you would have to eat approximately 3,500 fewer calories on a weekly basis, or 500 calories per day. If you wanted to lose 2 pounds per week, your goal is 7,000 fewer calories per week, or 1,000 calories per day. Does that sound like large numbers? It is. So when a person loses 5 pounds, that's a big deal. That's a huge success. And by becoming aware of what you're putting in your mouth and what's in your food and beverages, it can become simpler. Here's just examples, not picking on anyone or anything, but a 20 ounce of really any regular soda would have approximately 250 calories. From the people that I see most often, they're usually not having just one per day. So eliminating regular soda or switching to a lower calorie beverage could get you that 500 calorie deficit per day. And like Dr. Ortiz's example, if you are at McDonald's, instead of ordering a double quarter pounder with cheese for almost 800 calories, you could get a regular hamburger and a side salad or a small fry for about half the calories. Okay. This slide is just kind of showing where our calories are currently coming from. So in 2010, the average American ate approximately 2,500 to 2,600 calories per day. We're eating almost 500 calories more per day than we were in 1970. Okay? And the majority of our calories are coming from processed foods. Things that have added sugars, added fats, added salt in them. And Americans aren't getting enough of the really nutrient-dense foods, things that are great sources of fiber that will help keep you full and satisfied into the next meal, that can help with your blood sugar metabolism so that your sugars don't spike after you're done eating. That have protein and the right amounts of fat that are naturally in the food. So again, you have that satiety feeling, that you're not eating like a rabbit all day long and just never feeling satisfied. So I thought that was interesting. This is from, has anyone heard of the Diabetes Prevention Program? It's a group education that was created after a research study called the Diabetes Prevention Program. It was intense behavioral therapy, a calorie restriction, so they got counseling and coaching on making better food choices. Anyone heard of that? A couple of nods. So this is the curriculum. When you start that program and you get that initial body weight, how they track their intake is they start by just tracking the fat grams that you eat in a day, because fat has the most calories in your diet. So the assumption is if we can find the fat and reduce the fat, we can hopefully reduce your total calorie intake too. And then intensifying that, if people do hit that plateau, or they may have replaced those high-fat foods with, just simple sugars or something like that, then we might start tracking calories with them as well, so we get that balance, and you're getting the right amount of each nutrient. So these are some suggested tracking tools, because it's really hard to make changes unless you are aware of what your baseline is. So some people prefer pen and paper. There are some phenomenal smartphone apps and iPad apps, and I don't know, that's technology really kind of above my brain too. But MyFitnessPal is an example of one. Spark People is an example of one. Lose It, that are all completely free that can help you track your intake and activity on a daily basis. And then for people who don't like numbers, and kind of want to gradually modify their meal plans, simply using visuals like the healthy plate method can be really effective to help people improve their overall health and reduce their risk for chronic disease like diabetes. So you have your 25% of your plate is a lean protein, 25% of your plate is a slow digesting carbohydrate or something with fiber in it, a starch if you will, and then 50% of your plate, we really want to try to get those non-starchy vegetables, or you could have a little bit of fruit in there too. Has everybody seen that visual before? Yeah. Okay. So think before you drink. Dr. Ortiz mentioned this earlier too. It is amazing the power of your mind. This is one of the behavior changes you could make. Simply changing the type of glass that you use can help you naturally reduce how much you consume. So tall, thin glasses, people perceive that they're getting more than if it's a short, stout glass. So you could be drinking less if it's a caloric beverage that way. Does everybody know what this visual on the upper left is? With the holidays? Eggnog. Eggnog, yes. 8 ounces of eggnog. Well, how many calories do you think are in 8 ounces of eggnog? So, safe answer. But how many? 400 was one guess. 650. It's actually 344 calories for an 8-ounce glass. I would argue, though, the same thing is observationally how many people would have one glass, or would they have an 8-ounce glass and not a 10-ounce glass or a 12-ounce glass. But that is just a great example of, if you don't know the numbers, it's kind of hard to estimate at the end of your week. If you didn't lose any weight, or if you gained half of a pound, going back and looking at the details can really help you figure out why that's happening. Those naked smoothies, everyone seen those on the shelves? Okay. Approximately 270 calories in a beverage that size. And then energy drinks, my nemesis. Any guesses on how many calories would be in an entire can of Monster energy drink?
Why do you call it nemesis?
Oh, just being a stimulant, and there's a lot of research to support that it could actually increase people looking for calories at that point, even if you're choosing a low-carb version or a sugar-free version. 200. Yep. Oh, excuse me. I put the red thing right at you. Yeah. It is about 200 calories for one Monster energy drink. So it's worth taking a minute to reflect where your fluid sources come from, and do they contain calories or not, and is it worth it in your meal plan? So if you love 2% milk, and if you were in my office, I would never tell you that you can never have 2% milk again. We would find a way to make that fit, but we have to negotiate something else. Okay. So because we're short on time, I kind of went sort of the take-home messages is, for nutrition, we really just want to focus on nutrient-rich foods. Keep that healthy plate method in your mind. You cannot have enough of fruits, vegetables, and whole grains, naturally low in fat, naturally low in sodium, great sources of fiber, lots of vitamins and minerals. And then when you're choosing proteins, try to make them lean, trim them down, or buy them a leaner cut, bake them instead of frying them, and then the amount that you're having at one time. And then choosing low-fat dairy, because that can be a culprit for a lot of unhealthy type of fats in your meal plan too. And on the flip side, just to try to avoid added calories from fats, sugars, and salts, which salt wouldn't add calories, but is in a lot of processed foods. Okay, so more humor. I did a 30-minute workout today, 15 minutes looking for my sneakers, 10 minutes looking for my sweatpants, and 5 minutes on the treadmill. This guy is gradually getting into his workout routine. Yeah. The benefits of exercise are endless. Like really that could be an entire conference presentation, 3 days worth of the benefits of exercise. But real quick, obviously it helps with the weight management battle. It can help prevent or reduce risks with other chronic conditions like high blood pressure, high cholesterol, type 2 diabetes, some cancers, osteoporosis, that kind of thing. And I think this one goes a long way too. Our mental health, how we cope with stress, how we all have a relationship with food, and that's something to evaluate as well. Exercise is a great 1-2 punch that you can sort of cope with a negative emotion, and you can also improve your mental well-being. So, the recommendations we had listed on a previous slide, but from the CDC, it's listed here for you. Again, for important health benefits, so kind of that risk reduction, 150 minutes per week of moderate intensity aerobic activity, and muscle strengthening activities on 2 or more days per week that work most of the muscle groups. I looked this one up too. What percentage of Americans do you think are achieving this combination, these recommendations? Zero? Any more optimistic people in the room? 10%, 30%? 18% are getting that combination of exercise. And then for even greater health benefits, and this is to help support the weight management angle, to actually crank it up to 300 minutes per week of moderate intensity exercise, and then continue your muscle strengthening exercise as well. So, and to echo what Dr. Ortiz had said, this would be things to work up to. Before you start an exercise program, you really want to evaluate what is my conditioning and what am I able to do, so you don't go for that 3-mile walk and then find yourself stuck and no one to contact, because you twisted a knee or you're out of breath or whatever it might be. Or it takes you 3 weeks to recover and you say, to the heck with that. These are some examples of moderate exercise, so I'll let you guys read those over. I won't read them to you. What I love about moderate exercise is there's definitely some things on there that can also be productive. A lot of people would say that they don't have 10, 20, 30, 60 minutes in their day, that chunk of time, and that's why they aren't active enough. But if you're washing your car at the same time, you're checking off that off your list, and you're being active at the same time. Or if you're raking your yard or you're push mowing your yard, if that's realistic, you're still getting stuff done too. If you're walking to work, if you're in a work environment where you have meetings, you could have a walking meeting instead of sitting in a conference room. Can work for some people. Okay, so we talked about starting an exercise. This is just the activity pyramid, which I loved. Thank you for sharing this, Dr. Ortiz. Same information presented a different way. Things to try to do on a daily basis, a few times a week, about 3 times a week, and then screen time. We really want to try to limit the amount of screen time that we're exposed to, because there seems to be an association or a correlation, I don't know what the right word is, but people who are in front of a screen more often tend to have weight problems and higher risk for chronic disease. Okay, this is just ways to sort of assess what your fitness level is so that you don't get out of the gate too strong, too fast, and then either have an injury or have burnout. So it's called the FIT principle. How you can, another way to decipher between moderate physical activity, hard physical activity, or very hard physical activity. So we talked about nutrition, we talked about exercise, a few minutes on behavior strategies, and they kind of support what you're trying to do nutritionally and physically as well. So this is my health coach and life coach. This is my dog Sierra. So I take any opportunity to share her because she's so cute, I think. But you know, she gets me outdoors, she needs to go for a walk, I need to go for a walk. It's something I can do above and beyond what I also might have planned in my day. You know, we're companions and we're buddies. She always listens when I have a stressful day, so she's my coping strategy instead of stopping somewhere on the way home and picking something up that might give me an instant gratification, but then a minute later, I really regret, you know, eating those Skittles or whatever it might be. And then even nutritionally, I'm embarrassed to admit it, but we totally talk when we're making food, and we tell where her food came from and where my food came from and how pretty the colors are and how good does it smell. So we really work up the event to the actual meal time. So she's what works for me. And you know, I share that experience because when I say it out loud, it sounds kind of silly, I think. But get creative. You know, there is not a one size fits all in any way, shape, or form. So we put all the ideas on the table. Mindful eating, I will not read this entire definition for you, and Dr. Ortiz had mentioned it earlier too, but this is huge. I mean, we really have lost that connection with food just because of all of the expectations that we have in our day anymore. And there is something too connecting that brain and that gut and stimulating the senses before you even put anything in your mouth. When you take your time and you appreciate what's on your plate, people tend to eat less and they tend to take more time, and so the hormonal signals send that message to your brain too that you've had enough and that you can put the rest of the cake in the fridge until tomorrow or until the next time that you eat something. So I know we're really short on time, but some more information on portion control, the hand method, so that's something you can find online as well. But measuring cups, food scales, using your hand to estimate serving sizes can help with your tracking if you're doing that. And then this was something we were going to do together if we had enough time. But really think about what the barriers are in your life that are getting in the way of you bringing your lunch to work or going for that 30-minute walk when you get back from picking the kids up from school, and start to break down those hurdles so that it can turn into a new habit and something you look forward to doing and also benefit your health that way too. So motivation. I think one of the things I just want to emphasize here is, you know, slips and hiccups are completely normal. It's kind of how we react to those, and proceed from there is where a lot of people kind of get into a slippery slope. When we have a black and white thinking, and you know, on Monday to say that I'm never going to have a diet Dr. Pepper again, and by Monday afternoon I've had one, so then I say, okay, January 1st, New Year's resolution, you know, like to wait an entire month or 2 months before starting that goal again. Pick up where you left off, and the next time you're in an environment where it's an option, I can say I have my water bottle with me, or I didn't bring any money intentionally, so I couldn't pick one up even though I didn't want one. Those are the types of things I'm referring to. And then I'll let, if you want to speak to these slides.
All right, so just kind of to wrap things up, I wanted to kind of let you guys online. There is a very good, powerful assessment tool, other than the one I told you guys at the very beginning, that you can get your information. Oh, this is what I needed. You can enter your personalized information. You put your results. And it'll give you a whole profile, and it'll help you kind of get in track. And it looks something like this. You go to diabetes.org /PhD or personal health decisions, and it'll help you kind of figure out what are your particular risks, and then it'll help you keep track of your information. So it's a very powerful, free, easy, readily available program. So it's really nice for you guys to do. And then just our take-home message from both of us, we just want to remind you guys, you can reduce your risk. Get physically active. Remember the key point, 10 minutes, 3 times a day. Can be 3 surges of 10 minutes to 150 minutes per week. Healthy eating. Remember, just do the plate. It's easy. Cut in half, 50% of fruits and vegetables, and the other 50% has to be on your protein, your lean piece of meat, and your starches. Weight management. Remember, just losing 7% of your body weight, okay? 10 pounds. Adopt healthy habits. Among that, obviously, tobacco cessation, and just stress reduction. Have your regular checkups. I have so many patients who say, I just don't go because if I don't know, I don't have it. So you got to remember that. Your doctor's supposed to be your team. It's part of your team. So you don't go there to be scolded. You go there to get support. And if you're getting scolded, then get a new doctor. All right. Manage your stress. Okay? That's really important. It's unremarkable how much weight you gain just because you're stressed out. You eat more when you're stressed. Your metabolism doesn't work when you're stressed. You increase your inflammatory markers when you're stressed. You're more likely to develop cancer, diabetes, and heart disease from stress. Okay? So we just want to thank you guys. This came from Therese. If we're creating ourselves all the time, then it's never too late to begin creating the bodies we want instead of the ones we mistakenly assume we're stuck with. Okay? So thank you very much.